Welcome to the AACS Daily News. Non-essential businesses across the state have been closed due to the coronavirus, and so have the state's schools. This means that young kids are home and many parents are having to guide their children through this time. We spoke with mental health representatives from Fuller Hospital on ways parents can help their children.
Hi, my name is Kim Rodriguez. I'm the Director of Clinical Services at Fuller Hospital.
And I'm Dale Hirschman. I'm the Director of Case Management.
So I think in light of everything that's happening in the world, we've definitely seen, patients just really concerned about how this impacts their personal lives. Kids are home a lot more, and their parents are having to be creative with their time as well. I think in some ways we've had this conversation with some of our patients who say, for example, are on our developmental disabilities unit and don't understand necessarily what, coronavirus is or how that impacts their day-to-day life. And so we've, shared it with them in a way that expresses that we have to just be safe in taking care of ourselves, and, masks keep us healthy, and staying, distant from people allows us to ensure we're safe and they're safe, and really kind of keeping the conversation around safety and health, versus focusing as much on necessarily like the virus and what it is, but really just kind of teaching children that this is an opportunity to, wash our hands frequently and educate and support around safety and health. So, less attention on what exactly the virus is, but more around why we're doing what we're doing, and that's to stay healthy.
And for parents, I think the other component to look at is to try and turn this into a engaging period of time where they're engaging in more positive activities with their children and really using the time that they may not have on a regular day-to-day basis when people are working in multiple activities, really trying to value the time to connect in different ways.
And I mean, given the, the situation, it's really an opportunity, like Dale said, to connect as a family and have some real honest conversations, and acknowledge what is, right? Because this is uncomfortable, and it's not something we run into where kids literally, can't go to school and can't connect with their friends or their family like they had been consistently. And that brings up a lot of questions and unknowns and uncertainties, but just having some honest conversations around how they feel and what is this doing for them and how are they impacted by it, I think just can allow for some honest conversation.
And one of the things I think we talk a lot about in mental health is focusing on the things you have control over and not the things you don't. So people should try and look at what areas of their life they do have control over and take that kind of control over those areas rather than primarily focusing on all the things that are out of our control.
We've got a lot of different types of treatment that can still help people through this challenging time. And, like Dale said, while most of the world is kind of shutting down and being forced to isolate, working in mental health, we're open, we're running, we're here, we're supportive, and just you don't have to feel alone during these challenging times.
That's it for today's update. If you are an organization or government official that would like to share information with the public on AACS TV and WARA 1320 AM, you can email news@aacs.com. For AACS News, I'm Austin Ricketts.